Hello, my name is Rosemary. I am currently studying at Grand Canyon University. Today, I'd like to discuss with you ethical issues and research surrounding communication. The ethical implication in human research as it applies to allied healthcare professionals. When conducting research, it is important to protect the right of research participant, enhance research validity, maintain scientific integrity. Some ethical implications can include, but are not limited to, the risk of distress, loss, adverse impact, injury or psychological or maybe other harm to any individual, such as the participant, researcher, bystander, or participant group. By putting those into consideration, it will help prevent unnecessary benefit claim to the individual, such as financial, reputation, privacy concerns, or issues, and this is where the use of informed consent plays a significant role. Identifying the principle of scientific communication. It is important to have a set of clarity, a clearly written, accuracy, accurate data, and making simple, easily accessible report of medical studies, and understandability on view, because how the public would view and understand it is critical to the subject matter. Analyze some of the ethical issues around communication when conducting research. It is important for your study design to get ethic approval, such as the IRB agency. According to COPE, good research should be well adjusted, well planned, appropriately designed, and ethical approved by the data analysis, authorship, conflict of interest, and by avoiding redundant publications. Communicate effectively and appropriately with patient families and health care providers within the scope of practice. It is important to communicate effectively and appropriately with patient and family. Effective communication skills within a healthcare setting are critically important. Workers within a healthcare setting must communicate clearly with each other to best coordinate care delivery to patients. It is important to listen. Many people think of communication as talking, but listening is an important, or arguably more important. Pay attention to nonverbal communication. Words are only one part of what you may be saying. Make sure you are being HIPAA compliant as well. Communicate effectively and appropriately with health healthcare providers. It is important to be prepared before making an appointment with your provider. It is important to do some research on your health issues and make sure that doctors you are interested in are accepting your health insurance. Share information. Share all health information to your provider. Ask questions. Get it in writing. Get it in writing will help you remember what was discussed. Follow up. It is important to follow up on treatment plans. Demonstrate effective skill in writing formal correspondence to communicate information and ideas. A verbal communication relies on body language and your voice tone to deliver information. Written communication skills use grammar. When written communication skills use grammar, punctuation, and words for written communication to be effective. Ensure it is clear, concise, complete, and cautious. It is important to read back information when communicating to physician or patient for better clarification. Communication is an effective tool when communicating with patient and avoid using abbreviation. When communicating with other people for better understanding. In healthcare, it is important to have a good communication skill because it will help for a better patient outcome. Thank you, and that's all I have to say.